The foundation of pharmacology, quality and safety. Pharmacology. Pharmacology is the scientific study of drugs and their interactions with living organisms. It encompasses the understanding of how drugs work, their effects, and their potential risks and benefits. Drug. A drug is any chemical substance that has the ability to affect the processes within a living organism. Drugs can be synthetic or natural compounds and are used for various therapeutic and diagnostic purposes. Pharmacotherapeutics. Pharmacotherapeutics involves the application of pharmacological knowledge to clinical practice. It's the use of drugs to prevent, diagnose, or treat diseases and improve patient outcomes. Pharmacodynamics. Pharmacodynamics is the study of how drugs interact with target cells or receptors within the body and produce physiological effects. It explores the mechanisms of drug action and the relationship between drug concentration and response. Pharmacokinetics. Pharmacokinetics focuses on the processes that influence the absorption, distribution, metabolism, and excretion of drugs. It helps understand how drugs move within the body, how they're metabolized, and how long they remain active. Adverse drug reactions, ADRs. ADRs are unintended and harmful effects that result from the use of a drug within the prescribed dosage. These reactions can range from mild to severe and may occur due to factors like individual variability or drug interactions. Side effects. Side effects are predictable and often unavoidable effects that occur as a result of a drug's therapeutic actions. They are secondary effects beyond the primary intended outcome of the drug. Toxic effects. Toxic effects occur when the drug dosage exceeds the therapeutic range, leading to harmful physiological responses. These effects can be acute or chronic and may cause organ damage or other health issues. Idiosyncratic reaction. An idiosyncratic reaction is an unusual and unpredictable response to a drug that is not based on the known pharmacological actions of the drug. It can vary from person to person due to genetic factors. Iatrogenic disease. Iatrogenic diseases are health conditions that arise as a result of medical treatment. This can include drug-induced illnesses, complications, or adverse effects caused by medical interventions. Pharmacogenetics. Pharmacogenetics studies how an individual's genetic makeup affects their response to drugs. It aims to tailor drug therapy based on genetic factors to optimize treatment outcomes and minimize adverse effects. Nursing process. The nursing process is a systematic approach that nurses use to provide patient-centered care. It involves assessment, diagnosis, planning, implementation, and evaluation of a patient's health and drug therapy needs. Medication error. A medication error is a preventable event that can lead to inappropriate medication use or patient harm. It can occur due to various factors such as communication breakdown, calculation errors, or inadequate knowledge. Quality and safety education for nurses, QSEN. QSEN is a framework that emphasizes the integration of quality and safety competencies into nursing education. It aims to prepare nurses to provide safe and effective care to patients. Basic concepts and processes. Pharmaceutics. Pharmaceutics is the science of dosage form design and drug delivery. It studies how drugs are formulated into various dosage forms such as tablets, capsules, creams, and liquids to optimize their efficacy and safety. Bioavailability. Bioavailability refers to the extent and rate at which a drug reaches systemic circulation and is available to produce its pharmacological effects. Factors like absorption, metabolism, and route of administration influence bioavailability. Pharmacogenomics. Pharmacogenomics explores how an individual's genetic makeup influences their response to drugs. It involves the study of genomic variations that impact drug metabolism, efficacy, and potential adverse reactions. Placebo effect. The placebo effect is a psychological response to a treatment that has no therapeutic effect on its own. Patients may experience perceived improvements due to their expectations and beliefs about the treatment's effectiveness. Half-life. The half-life of a drug is the time it takes for half of the drug's concentration in the bloodstream to be eliminated. It provides insight into how frequently a drug needs to be administered to maintain therapeutic levels. Steady state. The steady state is the point at which the amount of drug being administered is equal to the amount being eliminated, resulting in a relatively constant drug concentration in the body. And benefits. Drug. A drug is any chemical substance that has the ability to affect the foundation of pharmacology. It helps determine when a drug's effects can be expected to start. Peak plasma level. The peak plasma level is the highest concentration of a drug in the bloodstream after administration. It indicates the maximum drug concentration achieved and can influence dosing intervals. Duration of action. The duration of action is the length of time a drug's therapeutic effects persist in the body. It helps determine how frequently a drug needs to be administered to maintain its effects. Therapeutic range. The therapeutic range is the range of drug concentrations in the bloodstream that provides the desired therapeutic effects without causing significant toxicity. It guides dosing decisions to optimize treatment outcomes. Loading dose. A loading dose is an initial higher dose of a drug given to rapidly achieve therapeutic plasma levels. It is often used when immediate effects are needed. Maintenance dose. The maintenance dose is the dose required to keep drug plasma levels within the therapeutic range after the loading dose. It sustains the desired therapeutic effects. Pharmacoeconomics. Pharmacoeconomics studies the economic aspects of drug therapy, including the costs and outcomes associated with various treatment options. It helps evaluate the cost-effectiveness of different interventions. Medication administration and the nursing process of drug therapy. Routes of administration. Routes of administration are the different methods used to deliver drugs into the body. They include enteral, parenteral, and topical routes. Enteral routes. Enteral routes involve administering drugs through the gastrointestinal tract, such as orally, by mouth, or through rectal suppositories. The drug undergoes absorption in the digestive system. Parenteral routes. Parenteral routes involve administering drugs outside the gastrointestinal tract, bypassing the digestive system. These include intravenous, intramuscular, subcutaneous, and intradermal injections. Topical routes. Topical routes involve applying drugs to the skin or mucous membranes. They include creams, ointments, patches, and eye or ear drops. Sublingual administration. Sublingual administration involves placing a drug under the tongue, where it dissolves and is absorbed directly into the bloodstream through the sublingual veins. Intravenous, IV, administration. IV administration delivers drugs directly into the bloodstream. This method provides rapid onset of action and precise control over drug dosage. Intramuscular, IM, administration. IM administration involves injecting drugs into muscle tissue. Absorption is slower than IV administration, and it's commonly used for sustained release formulations. Subcutaneous, SC, administration. SC administration delivers drugs into the fatty layer beneath the skin. It provides a slower and more sustained release compared to IV or IM routes. Intradermal, ID, administration. ID administration involves injecting drugs into the dermis layer of the skin. This method is often used for skin tests, such as tuberculin testing, where a small wheal or blister is formed as the drug is absorbed slowly. Intrathecal administration. Intrathecal administration involves injecting drugs into the spinal canal, usually via a lumbar puncture or spinal tap. This method allows drugs to directly reach the cerebrospinal fluid, affecting the central nervous system. Nursing process. The nursing process is a systematic approach that guides nurses in delivering patient-centered care. It comprises 5 steps. Assessment. Gathering comprehensive patient information, including medical history, current health status, and drug therapy needs. Diagnosis. Analyzing assessment data to identify health problems and formulate nursing diagnoses related to drug therapy. Planning. Collaborating with the patient and healthcare team to set goals and develop a plan of care, including drug therapy interventions. Implementation. Administering medications as prescribed, monitoring patient responses, providing education, and addressing any potential issues. Evaluation. Assessing the patient's response to drug therapy, determining the effectiveness of interventions, and adjusting the plan of care as needed. 6 rights of medication administration. The 6 rights serve as a safety framework to ensure accurate medication administration. Right patient. Confirming the patient's identity before administering any medication. Right drug. Verifying that the medication matches the prescription or order. Right dose, ensuring the correct dosage is calculated and administered. Right route, confirming that the medication is given through the appropriate route. Right time, administering the medication at the prescribed time intervals. Right documentation, accurately recording all medication administration details, including the drug, dose, route, time, and patient response. Pharmacokinetic phase. The pharmacokinetic phase of drug therapy involves four main processes. Absorption, the movement of a drug from its site of administration into the bloodstream. Factors affecting absorption include dosage form, route, and patient factors. Distribution, the transport of a drug from the bloodstream to its target tissues or organs. Factors such as blood flow, protein binding, and lipid solubility influence distribution. Metabolism, the enzymatic conversion of drugs into metabolites, primarily occurring in the liver. Metabolism can affect a drug's potency, duration of action, and potential interactions. Excretion, the elimination of drugs and their metabolites from the body, primarily through the kidneys. Renal function plays a crucial role in drug excretion. Pharmacodynamic phase. The pharmacodynamic phase focuses on how drugs interact with target cells or receptors and produce effects. It involves studying drug receptor interactions, signaling pathways, and the resulting physiological responses. Tolerance. Tolerance occurs when a patient's response to a drug diminishes over time with repeated administration. Higher doses may be required to achieve the same therapeutic effect due to adaptive changes in the body. Dependence. Dependence refers to the physiological or psychological need for a drug to maintain normal functioning. It can manifest as physical withdrawal symptoms or psychological cravings upon discontinuation. Withdrawal. Withdrawal is the set of physiological and psychological symptoms that occur when a drug-dependent individual stops or reduces drug use. Symptoms can range from mild discomfort to severe distress. Polypharmacy. Polypharmacy is the simultaneous use of multiple drugs by a patient. It can increase the risk of adverse drug interactions, non-adherence, and confusion, especially in elderly individuals. This comprehensive overview should help you grasp the key concepts, terms, and definitions covered in Section 1 of Abrams Clinical Drug Therapy 12th edition. Each chapter's content contributes to building a strong foundation in understanding the conceptual framework of pharmacology and its application in clinical practice.